you, Sahani sir. Good evening, good afternoon, and good morning. This is the 1530th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is a dietitian, MEERA Joseph. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. The first session of the day is already over, the Hindi session from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, local language session in Malayalam. All these sessions are going in a good way, and we are I'm very happy to say that we are uploading the videos of the same on the very next day itself. And those who miss the part of it or miss it completely can watch it again, and you can share it without your friends without paying a penny. That is the speciality of the International Forum for Promoting Homeopathy. We have doctors and eminent personalities from 65 countries have presented various papers on different subjects, and all these papers were really exemplary brilliant. And today, the guest of the day is we have lucky to have a dietitian, that is Miss MEERA Joseph. She is the daughter of a famous homeopathic doctor, Dr. Joseph from Alleppey. And she has completed her BSc in Food Science and Nutrition, SNDT University, Mumbai, and Sports Specific Nutrition Management from ASNF India. And she has certain specialities, clinical and sport dietitian with about a decades of experience in helping the ailing and unwell to get back to their healthy best through the reforms in their food and food habit and lifestyle. This is one of the area where every homeopathic doctor need to look in. Not only a homeopathic doctor, a doctor from doctors from all discipline has to look into it, because we need to control some kind of food so that the patient recovery will be very quick. And she has created customized diet plan for more than 10,000 patients and clients with clinical conditions such as cardiac diseases, renal conditions, and dialysis, cancer, etc., along with other common lifestyle disorders like diabetes, hypertension, obesity, etc. She helps athletes establish and aspiring to be all their optional best nutritionally at all times with economical and sustainable diet program, so they can get the best performance in every participant. She is the co-founder an online nutrition brand called Caring Cactus in pursuit of filling the gap between humanity and authentic nutritional service. She has published several articles on nutrition in dailies, as well as aired some programs through a network. She has a very important thing, a lifestyle teamer, currently pursuing MBA, and she's a lifelong learner, currently pursuing MBA and NIMS, a life member of IPCAN, All India Association of Parental and Eternal Nutrition. And this is all about Ms. MEERA Joseph. She has presented some papers in our Malayalam session earlier. And today, one of the best subjects to be discussed here, that is wellness in the workplace, practical insight for the medical community. So we proudly welcome the guest of the day, Dr. MEERA Joseph. Yes, you can begin the session. We can't hear you. Is there any problem with your mic? Uh, please unmute. Please mute and now please unmute once again. Please unmute once again. Yeah, yes. Some problem with your audio. There is nothing we can't hear. Please, you can talk directly to the laptop so that that may be better.
Hello, am I audible now?
Yes, yes. Now it is audible. Now it is audible. There was a problem.
All right, thank you. The thing is, I cannot hear you guys very well. So if you have any questions for me, please put it in the chat box so I can read and then answer them. Thank you, Dr. Dhanesh, for that wonderful welcome. I'm so glad to be here again with homeopaths, which is my favorite branch of medicine, since that's emotionally very close to me because my father is also a homeopath. And because of the holistic way of approach of homeopathy, that is again my style of treating diseases. That is the very reason I'm a dietitian. So this is an honor to be speaking here, and this is my third time being in this platform talking. I did one session not just in Malayalam, I've also done once in Hindi last year, and I'm hoping there are some people here who remember me. Okay, so from the brochure, you must have known the topic that we are about to discuss today, which is wellness in the workplace and practical insights for the medical community. So this is something that I have not heard people discuss anywhere. Okay, a wellness session for doctors. Usually we talk about workplace wellness for IT sectors and the corporate wellness, but never for doctors. You guys are the one treating the patients, making other people well, but I've never heard people or doctors themselves taking care of their health much. So I thought this would be the right time to talk about this and put things in perspective and start a conversation. And exactly for that reason, we will not be doing anything with a presentation here, because I want the session to be very, very interactive, and we'll be using the chat box very much. So please cooperate. Otherwise, that's the only way we can benefit from this. And so of all the sessions that I've taken before, today's, like I've said, it's not about a medical condition that we'll be taking notes of. So this is about starting a conversation, discussing, putting things in perspective. So that's exactly why it's going to be very face-to-face. All right, so please use the chat box and join me in the conversation. Can at least a few of you guys just type in hi in the chat box so I know that people are listening actually? Come on, any 5 or 6 of you? Just to make sure that I'm audible at least. Thank you, Dr. Nagwini Patil. All right. Okay, Dr. Sneha Krishna, thank you. Anybody else?
Screen sharing or not? Now, is there any?
Okay. So,
do you want to share the screen?
No, we won't be having any PPT today because this is a direct conversation. It's not like we're discussing a disease condition to take notes, symptoms, etc. So this is completely face-to-face. I want you guys to interact with me.
Because
this is a different kind of topic.
Okay, all the
sorry, yeah.
Mic is muted, so we cannot allow all of them to speak directly. They can write here.
Okay, you need the PPT. All right, I've got some notes that.
No. We have muted all the participants. Otherwise, there will be disturbance coming. So there is a request. All the participants can write down in the chat.
Okay. Let me just share the screen and.
Yes, it is visible.
Yeah, so this is the topic we are going to talk about today. So let me introduce myself once more. So I am the Chief Dietitian and Wellness Officer at Caring Cactus, which is my nutrition online brand. And just like Dr. Dhanesh had introduced, I was doing my MBA, and I'm glad to announce that I just finished my MBA. So now that's done. And I am a lifelong learner. So why I chose this topic exactly was to, there have been recent events, if you read in the newspaper, that a girl named Anne Sebastian, okay, she passed away due to work stress. She was working at Ernst & Young company. The girl was from Cochin, but the incident happened in Pune. And her parents blamed the company of work stress, etc. And there were many similar incidents that were being followed, like HDFC bank manager, and a lot of incidents followed after that, which is actually not a new thing. But this girl, Anne Sebastian's death, put things into perspective, and people started talking about it more. So that is why, as a dietitian, I also, because I'm into wellness, uh, the problem is, or the more worrying thing here is that, worrisome thing here is that a lot of companies, they have wellness initiatives for their employees installed in the workplace, but still, and they are spending quite a good amount of dollars on it, to be honest, but then things are not working. Why are these things still happening? So there is a gap between the programs installed, or the people who are, in my inquiry, I found out that not like 80% of the employees are not even bothered about this kind of programs that is installed, because they're getting it for free. Nobody really understands the importance of this. The companies are happy saying that we are giving these perks to our employees, and the people are just happy boasting about it, that these are the perks that we are getting from the company, but nobody's actually, taking care of that. People always go after Google reviews, or some diets prescribed by their favorite celebrities, etc., 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 and they get themselves into trouble. So we've been talking about this a lot in recent times, and that's when Dr. Dhanesh approached me for another session, and I feel myself to be lucky, okay, to be given a platform like this. And I chose this topic because everybody is talking about workplace wellness everywhere, but nobody is talking about the workplace wellness of the medical community. Okay, so that's where this is more important, because doctors, you are the guys, people who improve people's wellness, other people's wellness, but nobody is taking care of themselves into the account. Not even the general public, because we are getting more incidents of hospitals being attacked these days, doctors being attacked these days. So scenario is now completely changed, and doctors' health, the primary caretaker's health, has become secondary now. So if you don't have a robust, medical practicing community, then there's no hope for the world. There's no hope for wellness in any other place. So this is more important, and this is something we should start talking about. So that's the reason I came up with this particular topic. Now let's talk about why workplace wellness is very important in health. All right. So could you please mention in the chat box that what each one of you understand by workplace wellness? What is your understanding? Can I have at least 2 or 3 response here? Anybody? Just in a 1 word or 2. Hello? Okay, at least can you tell me, like, how many of you work for hospitals and how many of you are working on your own clinic, private practice? Because this is a lot dependent on the topic we're about to talk. Can you just type in PP for private practice and H for hospitals? Okay, Dr. Nagwini Patel is practicing privately. Anybody else? Dr. Jagdish Sevda in H hospital. Okay, so we have, I think we have almost equal number of private practice and also hospital practitioners here, which is great. So now, okay, so Now, why this becomes important, let me explain. Okay, in essence, workplace wellness is actually policies and programs and practices that support the physical, mental, and emotional health of employees. In this case, the doctors, the nurses, the pharmacists, the lab technicians, and the rest of the team. Okay, and these programs can vary widely from structured exercise and nutrition initiatives and to more flexible approaches like mental health support, ergonomic workspaces. For example, somebody, a lab technician who's working in the hospital's lab, they their focus should be more in the ergonomic workspaces. Okay, so it can vary depending on your department that you're working in and the type and your job hours, etc., etc. So in medical setting, wellness isn't just about feeling good. I think many people mistake wellness for just feeling good or generally healthy, but that's not, that's a very superficial term for it. It has direct implications to the quality of your patient care. Okay, and especially in healthcare professionals, they face unique pressures. You can argue that every work has a unique pressures, but in case of doctors, it's even more complicated. Intense work hours like never before. Like IT sector started working overnight and 24/7 in very recent decades, but doctors has been doing this for several decades now. And emotional demands from the patient care. You would be facing people who are about to see their death. I mean, in very critical conditions, their family, their primary caretakers. So you are always, most of the time, under constant pressure and emotional demands of the people around you. And then there is administrative responsibilities, running a hospital. You know that even the tiniest error can backfire very cruelly. We are getting examples of it every day through the news. And often a constant exposure to high stakes situations, like, you know, making a life and death situation is a daily thing for doctors. So this environment can take a toll on the mental health of doctors and other healthcare practitioners, not to ignore anybody else. So leading to burnout, stress, and higher rates of depression or anxiety in a much more larger scale among healthcare practitioners than any other sectors, any other work sectors. And this is not being talked at all. And when healthcare providers invest in workplace wellness, they create a ripple effect. Supporting practitioners in maintaining their health and well-being will make them equipped to handle these daily challenges and remain resilient under pressure, which is very, very, very important for the better care of the patients. And there are studies that shows practitioners who feel supported are more engaged, empathetic, and attentive to the patient, and the outcomes and satisfaction and trust in the care is like highly improved in the case of that. There are studies showing that. And the benefits of wellness and healthcare workplace are not limited to just mental health alone. Physical wellness programs to reduce injuries and support sustainable practices like regular movement, proper posture, nutritious eatings. All these things are also equally important. And uh, mindful sessions, counseling, etc., are very important to even doctors who counsel the patients and their caretakers. This is very important for doctors too, because you need to recharge your battery to be able to give out energy to the others. So in today's sessions, this is what we are going to discuss more and how we can implement some practical tips in your practice. Okay, this is the essence of what we are going to talk today. Now, can can you please like type in the chat box that how many of you have a wellness program or something similar, or any idea that you ever tried in your institution? If there's a wellness program, is that in place? Just yes. Can you type in yes if you have one, or no? Yes or no? I'm not expecting this in private care practices. If you have that, that is good, well and good. But at least for the doctors who are working in private hospitals. So Dr. Nagvini Patel says no. Anybody else? What about Dr. Jagdish? You work in a hospital. Do you have a wellness initiative there? Dr. Lata? I'm guessing no. Okay. So yeah, this is a problem. So let's talk about the high stakes decision making. Each day, physicians, nurses, and other healthcare providers make crucial choices under pressure. Especially when we're talking about hospitals, you have the critical care unit, the dialysis unit, the cardiac unit. In all these places, it's a daily chore that doctors and nurses and all other practitioners have to go through about making, critical decisions, okay, high stake decisions under pressure, whether to go for a surgery or not, or things like that. And the patients and their family are usually not very supportive, okay, for obvious reasons. So there are plenty of times where doctors and the team has to take a risk, okay, and you have to be always in your best mental state to be able to make these decisions and to expect accurate outcomes from that. And then there is emotional labor when you're talking with the patients, convincing them to undergo a specific treatment or convincing them about the outcome. Or you have a newly found, patient about maybe it's a chronic disease, or maybe they're newly diagnosed with cancer. So you are always facing these kind of, you can say, low energetic people, where you don't just have to uh, nurse them back to health, but you always have to be their support system. And what about your support system? So that's where wellness initiatives are more and more important in a workplace setting in healthcare. So, and extended hours and irregular shifts. You could just finish a night shift, and tomorrow morning, just after 2 hours of sleep, you could be called in for work, for an emergency, or covered for another practitioner. So these are like very often, it's almost a daily thing happening in hospitals, especially. In private practice, yeah, you may have some control over your work hours. So this comes at a sacrifice of your personal time and rest. You don't have time to unwind. You don't have time to eat properly, sleep properly, absolutely nothing. And then there is always this. This is a very unique risk that doctors and other healthcare professionals are facing: the risk of being exposed to illness regularly, on a regular basis, and the risk of infection. We saw that during the time of pandemic, you're always at risk, always being exposed, where other people are staying safe at home, trying to be safe at home. Doctors are always out there taking care of the ill. So this exposure is not just specific to the doctors, and it's also for your family too. You're bringing back all this infection back to your family, where your spouses and children and maybe elderly in the family are also being exposed. So this is a more important risk, a very unique set of risks than other people. So this can all lead out to burnout among healthcare practitioners than any other sector, work sector. But people somehow is still ignoring that. I don't know why. So many of the doctors that I know in my circle, they have this I don't know, some sort of embarrassment in admitting that they feel sick or burnt out. I don't know why. Okay, in their heroic efforts to stay supportive to others, they just like to ignore themselves. And that is generally taking a toll according to the studies we've come across everywhere. So this burnout can result in reduced focus, okay, especially in high risk decision making, in the empathy, okay, that is where you can see a lot of doctors sometimes shouting, maybe not at your patients, but I've seen this happening in hospital corridors to their nurses or the rest of the team, okay, and dull energy all the time. So these can happen. And if you have a proper wellness initiative, if you start taking care of yourself and your team, these incidents can be reduced a lot, and you could be more work efficient. And trust me, patients can always feel this energy shift in you, because they look up to you for their possibility. So they can always feel that when you're feeling low, the patients can always feel that. So if it's a first time a patient at your clinic, their review may also, get a star down, which is very possible. In some cases, it can even lead to medical errors. Okay. And studies from organizations like Mayo Clinic and American Medical Association reveal that high burnout rates in healthcare correlate with lower patient satisfaction and increased instances of care-related mistakes. So these are proven results. And also, according to a study published in JAMA Network Open, about 44% of physicians report feeling burnt out. And for some reason, this is being revealed mostly on the studies. On a face-to-face interview, most doctors won't admit that. And this figure has been rising significantly in recent years. I mean, it was just below 20% a few years back. That was a sudden shoot up to 44% recently. And another survey found that nearly half of all the healthcare professionals are considering leaving their positions to reduce their working hours primarily due to burnout and stress. So it's all taking an emotional toll on people these days, which is very evident. So this is where workplace wellness, you should be considering workplace wellness, even in your private clinic, private practice, and in the hospital. And the research is very promising. It shows that 25% burnout was reduced when people started implementing workplace wellness in their clinics, according to the New England Journal of Medicine, a study by them. And the program should focus both on physical and mental well-being. It has to be both, okay? And you are the torch bearers of wellness, workplace wellness initiatives at your place, being doctors. So it cannot be just for your patients, it should be your team. Even if you're running a small clinic, okay, just with one assistant or a junior doctor helping you out, or just a pharmacist or a receptionist, you are the flag bearer of this project. You are a doctor. So you are not just responsible out there for society, you should be taking care of your own team too. So this is all about fostering a culture of self-care, and self-care meaning your team's care. Okay, so you should be the one who actually be starting this initiative in your clinic rather than just advising your patients. And it's always glorified, especially in the corporate world, that burnout and exhaustions are simply part of the job. Okay, this is how you get things done, and that is glorified as a success formula. Okay, which is very wrong. So you could be the flag bearer of this. You should be. And so there are many healthcare organizations who've invested in wellness programs and shown results. But sadly, these are happening mostly in the US and the Europe. Indians are yet to catch this up, the trend, or to open their eyes to it. Okay, so now let's start with what are the initiatives that we can implement. Okay, we should be focusing on a wellness program for your clinic or the hospital. So there are key pillars, 4 key pillars. One is physical health initiatives, mental health support, which is even more important, and work-life balance strategies.
Hello.
And the 4th,
hello. Whether you
hello?
are screen now? No screen is
Can you
visible.
please?
Your screen is not visible. Your screen is not visible.
1 second, I cannot hear you. Let me.
I shall write down. We can hear you, but the thing is that whether you are sharing the screen or not.
Okay. Sorry for the technical issues. All right, so let's talk about the key pillars. So the first one is physical health initiative, and this is foundational to any wellness program, okay? Given the physically demanding nature of healthcare work. So it could be like long shifts on your feet. You have to identify when you are trying to implement a physical health initiative or try to include that in the wellness program. The consideration should be on the type, on the department that you work in. For if you're a surgeon, you may be working long hours on your feet. So that should be considered an account. Or if you are a general practitioner sitting in a clinic. So it could be long time, long work hours on a chair. So these are the things we have to consider when you are designing a program for your clinic. Okay, so it's very, very specific to the department and your the shifts and the certain muscle groups that you're straining. Okay, in by the nature of your work. So these are like very crucial. And physical health programs in a healthcare setting often include structured activities like regular exercise classes. You might be wondering how we are going to find time for that. It will work out, trust me, by the end. And on-site fitness rooms, okay, in the hospital. If that is in the clinic, you can definitely find your space. And personalized ergonomic assessments. For example, a hospital might offer yoga or pilates classes that can be attended either in person during break hours or accessed virtually for shift workers. Okay. Other effective options are steps challenges or group fitness competitions that encourage team engagement. Just to give you an example, in one of the hospitals that I've been working with as a wellness officer, one thing that we tried with the healthcare practitioners were avoiding the lifts unless it was an emergency. So they were encouraged to take the steps. And so initially it was a bit troublesome for people because they started getting burned out just because of that. So unless there is an emergency where you had to rush to some place, they were encouraged to take the staircase. After the first week, uh, you know, most of them found that taking the stairs are more easier and more, less time consuming than waiting for the lift. Okay, so which means their lung capacity increased and their mood generally increased. And because of that movement, they started enjoying the work much more. It was never a problem. So this was something that I witnessed myself. Okay. Now, the next pillar would be mental health support. Before we talk about mental health support, I'm changing to my phone. Okay, so we are moving to the second key pillar, that is mental health support. Okay, this is the second core component of a mental health support of a wellness initiative. So as we discussed earlier, healthcare professionals face a range of mental and emotional challenges. The greatest example would be high stress decision making and emotional fatigue from patient care. And all the challenges of the recent world where doctors are expected to give an explanation for every tiny thing that they do and every dosage of medicine to the caretakers, because everybody comes Google educated these days. So you are supposed to explain things to the people. So this makes mental health support a top priority among doctors, and programs that provide easy access to confidential counseling services or therapy sessions can be transformative, offering healthcare providers a safe, professional space to process stress and prevent burnout. Like I said, for many reasons, many healthcare professionals takes a step back when it comes to like admitting that they are burned out or under stress, probably because they are worried that people find mistakes in their job and they blame it on this admission. Burned out and stressed out, and it is okay to talk about it. But then you have to have a professional, or you can also find your own team to do the wellness initiative. Okay, make a team. We'll come to that part in the end. Again, like I've said, mental health support is also a core when it comes to wellness initiative these days. And in addition to counseling, you can incorporate mindful sessions or guided meditation breaks. Okay, meditation can be done in just 5 minutes, so you don't need a very, very long thing or an hour-long session or a couple of hour-long session. It can be even done on your break time. It can be flawlessly incorporated into your work regime. So this is very, very much doable. Okay. A 5-minute guided session, a guided mindfulness exercise session at the beginning or the end of your shift can be very, very helpful. Trust me, like you just need to try this. It can reset your focus, lower your stress,
and create a mental boundary between work and personal life. All right. And basically helps you compartmentalize your life and your work, which is very important for your focus. Now, even virtual option ceases, like now we are doing this virtually. There are a lot of organizations who successfully implemented virtual wellness initiatives also. If your team is not that great, for example, if you're running a private clinic and your team comprises of maybe 2 or 3 or 4 persons, you can try and opt for an outsider. I meant a third party, wellness programs, and you can have it done virtually also. Um, and okay, to give you another example, the Cleveland Clinic, okay, that's in the US. I think most people must have heard of it. So in Cleveland Clinic, they introduced a code lavender. So as you may be aware, there is this code in hospitals, right? There's code red, code blue, code black, code white. Okay. So for various situations, emergency code. So they had introduced this new code lavender. It was a rapid response for emotional support of the healthcare practitioners there. So if a staff member is feeling overwhelmed, they can call a code lavender and the support team will respond to provide immediate emotional care, offering everything from stress reduction techniques to short counseling sessions. So usually if you're working in a big hospital, you can have an in-house team for this, like a psychiatrist or a social worker. You can have a team. But if you're running a private practice clinic, you can always take support from a third party. Or you can even try to come up, it's very simple. You can sit down with your own team, talk about the general issues that they are facing, and you can come up with your own plan designed by you. You can even take help from, people like me or anybody else, any other dietitians or people who are working in the wellness sector. You can take tips from them. You can even design your own program and implement. But that will make all the difference, trust me. And the third pillar would be the work-life balance strategies. That's a third component, and it's particularly challenging for the people in healthcare because many healthcare providers work long shifts, nights and weekends even, which can lead to burnout if time and recovery. So I remember, even though my father is a homeopath, you may wonder what emergency can a homeopath face. But his mindset is that he should be available for patients first. So while we were growing up, to give you an example, there were this very few Sundays that we would get with my father, go out for a movie or go out to the beach or something. There have been a number of occasions in my life where we'd be ready to go out with my father, and the call from somebody else a patient comes even on a Sunday, and my father would be like very happy to attend that, leaving us. I mean, he was also feeling bad and guilty at the same time for leaving his kids behind, but he would always take out a minute or two to explain to us. Just like you children, there is this other child out there who cannot go out with their parents because they are ill, the parents are ill, so we can help them and we can go next week. So many a times this has happened in my family. So it's all about the mindset. There is even for homeopaths or any other non-conventional practitioners or Ayurvedic practitioners or Ayush group, this can happen, completely dependent on a practitioner's mindset. So it can happen. So which means you are also, even though you're not running a busy hospital, even if this is a private practice, depending on your personality and the type of patients you're dealing with, mostly you could be like as busy as hell. So you don't need to be a surgeon for that. I completely understand that. So even for you, this is very important, the work-life balance strategies, because over time, there are doctors who are going through personal tragedies also. From my personal experience, I know from my friends group, a lot of families are not very supportive either. There are some marriages that have failed. Those are some extreme cases, I agree, but even that can happen. Be able to be there for your family members when they are in need, when you're putting your work first, which is very noble. but also striking a balance between work and life is also very important. And this can also be done smartly if you sit down and plan things accordingly, at least by 80 to 90%. If you have a properly designed wellness initiative implemented, this is possible. So some organizations like Johns Hopkins have incorporated designated wellness days for their medical staff. So this wellness days is not a new concept. Like I've said, the corporate sector, especially the IT sector, has been doing this for decades, I think over a decade now. Wellness Wednesdays, you might have heard of this. So it's time that even in the healthcare sector, doctors, especially doctors and the rest of the team, start implementing that in the hospitals and your clinic. So these are days specifically designated for self-care and relaxation, not just for a day out in the beach or park or go out for a movie. Very specifically designed programs to, sustainable programs that could help you take off that stress. And, this is very important. Now, the fourth pillar, that is a peer support. Okay, now this is one of the reasons I wanted this to be a face-to-face interaction or not just a PPT thing, because this is the pillar that will prove that. Okay, so peer support is a fourth core element that can foster a culture of resilience and community in the workplace, because it's very easy to take a session on PPT, describe all the symptoms. If you're, for example, you're talking about a specific disease in case or a case study, so where all the details are out there in the PPT, you can take notes and you go back. Seriously, but how many of you actually go through those notes again? Can you be honest and put that in the chat box? Do you actually do that? Like, how many of you do that? No, be honest, it's all right. Or there are people like me who think that, okay, the recording would be available later, so I can always go back to that, but I never go back. I never somehow find the time to go back to that. So how often does this happen to you? Okay, all are very studious here. I guess it's just me then. Seriously, nobody? Hello? Am I still audible?
Yes, you're audible.
Okay. All right. So these things happen. So that is why I wanted this to be more engaging, and I wanted this to be face to face, because through my experience and through the help of some studies, I found out that the more you go into PPT, people will be focused only on taking out notes, and then people are never going to open that. Most people don't do that. So, but if you are more interactive, okay, if I start asking you questions and start a conversation, if you type in the comment box, which means, I can keep you engaged. You would think of this, you would want to answer me, you would be forced to answer me. So, which will put some things into perspective. There's a chance higher than that. So, that was the reason we took out the PPT. So, even in my experience, it's proven to be more beneficial. I'm hoping that this is working. So please be more responsive in the chat box. Okay, so why now we're talking about peer support. So unless you have created this atmosphere, this platform or of talking to person face to face, and without this peer support, without this fourth core element, no wellness initiative can work, because the people who should be implementing is the team. Okay, you're each other's support. So this is more and more important. It's high time that people start talking face to face, especially in clinics, because the trend that I generally see, especially in hospitals when I used to work them, it's like doctors take more of the brunt, or it feels like so. And then comes the second layer, that is the nurses. So, it keeps going down to the, housekeeping staff. So whoever's under stress, that is being now carried down the line to the housekeeping staff. And there are good and bad days, as you can see. So that is not how it should work. And I have seen like the lower staffs like crying in the corridor. So their burnout nobody is seeing. So like I said, it's a peer support. People should be able to talk about this burnout issue. And if they're facing something, the general response would be like, okay, we have seen this a lot. It's nothing new. We are facing this. So brace yourself up and you face this too. So, beyond that typical response, we should be able to come up with plans to make the whole team effective. So peer support is even more and more important. So the best idea for this is to form support groups. Okay, you can have a buddy group. Like the code lavender thing, another idea would be to install buddy groups where you can be the emotional support of each other, and those buddy groups can change, okay, every week, so that there'll be a good rapport built up between each of the team members. So this is specifically important in healthcare, where certain experiences can be difficult for outsiders to fully understand. Your spouses may not understand it completely, or your best friends may not understand this completely. They may be sympathetic, but they cannot completely empathize with you. So having this buddy groups in your workplace, in the clinics, is very important. Nobody else can take their place, being quite honest. So your colleagues are your best buddies when it comes to workplace peer support and wellness. So in structured peer support programs such as buddy systems, how it usually happens is there's monthly support group meetings. There are even weekly group support meetings. But if that cannot work, if it's like too hectic for you guys, you can at least have monthly support group meetings and allow healthcare professionals to support each other's well-being. And so these gatherings can create a safe space for open conversation and reduce the isolation that can come from high stress work environments. People often feel like, okay, they don't understand me. Okay, or you can mostly hear this from your subordinates. They are doctors, they just come and give us instructions, we will barge us off. It's on us. Nobody knows, nobody gets us. So this reflects directly on the outcome of patient care. So we all have to play a role here. We have to be supportive of even the lowest ranking team member in your clinic or hospital for the results to be ideal. And for example, some hospitals have also implemented debriefing sessions after particularly intense cases, mostly in the case of surgeries or accidents or traffic accidents or, those kind of critical cases. These debriefing sessions happen where the team involved can come together to discuss their experience, reflect, and decompress with support of their peers. Okay, there are instances where people may have, lost it under severe stress and may have shouted at their peers. So this will be later discussed in these kind of debriefing, and then, that is usually being sorted. And so basically, for all these are the 4 key pillars that we talked about. These components need flexibility and accessibility. So you cannot fix a time every week. I think that's not very practical for clinics or hospitals, because we are always facing emergencies. So it can, always, the time can always change. So it needs to be flexible. You mentally need to be flexible. So if it's not working today, you have to fix the next possible date for that, or the next possible time slot for that. Okay, so you should expect flexibility. It's not like, okay, you tried something for maybe every Saturday and you missed a couple of Saturdays in between and you cannot do that. Okay, it's not working. So Saturday is not working. You can try the next Sunday or Saturday. And so accessibility for all the team members has to be, taken into consideration. So that's how it works. Now the strategies. Okay, coming to the strategies. I see Dr. Danesh is about to say something.
Only 3 minutes are remaining. We have to finish the session.
All right. So I think, okay, if you have any questions, please ask me so far. Please ask me.
Yes, anyway, it's a very good session. And you really show what are the relevance in keeping wellness with hospital as well as in your clinic, and how one can do all those things. And anyway, these are the things every homeopath or whatever may be your profession, you have to look into. So
Yeah,
that we,
so please ask me questions if you have.
yes, yes, yes. If anyone want to ask a question, please raise your hand so that you can directly speak to Miss Meera.
Yes, please.
I invite Dr. Boblin.
I think Dr. Boblin just left
No,
a
he's
couple
here.
of minutes ago.
He's here. Yes, Bob.
I think he left.
No, he's here.
Okay.
Yes, he's opening. He's from Malaysia.
All right.
Yes, doctor.
Hello, Dr. Boblin, are you there?
Yes, yes.
Yeah. Hello.
Hello, Dr. Boblin.
Yes, sorry.
Hello,
Sorry,
nice
I
to
was
meet you.
yeah, very nice to hear your sharing today. It's something different from what others has been sharing. Dr. Meera, you have gone into another field, which
Okay,
very difficult for us homeopath, you know, to
right.
do the emotional and mental side. It's a
Yeah.
very good tonight, and thank you very much. On
Do you
behalf of
have any questions for me, Dr. Boblin? I hope it was you understood me, and
it,
I know there
there
have been
was some
technical issues in between.
there was technical delay and some problem, but
Yeah,
you managed to send it. But I hope that next time we can do some slight things so that we can keep it on record. You know.
all right.
Uh,
May I ask you a question? Like, what's the scenario in Malaysia about workplace wellness in clinics? Do
Sorry.
you have that? In Malaysia, you're from Malaysia, right? So do you have workplace wellness programs installed in your clinics there?
Is it a software you mean? Is it a software that we install in our
No,
clinic?
it's not a software. No. It's a program designed for the people who work there. So it could be a corporate sector, it could be a clinic, it could be any place. It could be a shop. So it is a specially designed program to each of the okay, I hope you seriously understood the whole session. I'm sorry if I wasn't very clear.
There is no we really don't understand fully what you mean, you see. But I hope that you can just send further information through IFPH, or we can have another session
Sure.
again, so that we can
Yeah,
have
sure.
more insight.
Okay.
Because at the present moment, I don't think we have any such thing in Malaysia yet.
All right. Okay. All right. Yeah.
Okay, thank you very much.
Thanks for the insight, Dr. Boblin. Anybody else?
Yes, thank you, Dr. Boblin, and this is the time to wind up the session. Thank you, Ms. Meera, to come over here and make such a brilliant presentation in this evening, showing your knowledge and sharing your knowledge and experience in those field. Congratulations once again, and we thank those participants who attended the session also. Hope you can also watch the same on tomorrow itself in our video will be uploaded at the YouTube channel of IFPH Homeopathy.
Thank you for all the people who stayed till the end and listened me out. Thank you very much.
Tomorrow we will have a session from Dr. B.D. Patel. The subject of discussion will be sanitizer side effects solutions. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session. Please unmute.
Okay, thank you, Dr. Dhanesh. Thank you, doctors in English session. എല്ലാവർക്കും നമസ്കാരം. ഇന്ന് നവംബർ 8 വെള്ളിയാഴ്ച ദിവസം IFPHന്റെ ഇടതടവില്ലാതെ തുടർന്നു വരുന്ന വെബ് പരമ്പരയുടെ 1530 ദിവസം. ഇന്ന് മലയാളം സെഷനിൽ നമുക്കൊരു ക്ലാസ് ആണ്. ഇന്നത്തെ ക്ലാസ് കേൾക്കുന്നതിന് വേണ്ടി സൂം പ്ലാറ്റ്ഫോമിലെത്തിയിട്ടുള്ള എല്ലാ ബഹുമാന്യരായ ഡോക്ടേഴ്സിനെയും ഹോമിയോപ്പതി സ്നേഹികളെയും സ്റ്റുഡൻസിനെയും എല്ലാവരെയും ഞാൻ വളരെ സ്നേഹപൂർവ്വം സ്വാഗതം ചെയ്യുന്നു. ഇന്നത്തെ നമുക്ക് ക്ലാസ് എടുക്കാനായി നമുക്ക് ഗസ്റ്റായിട്ട് എത്തുന്നത് ഡോക്ടർ റിജി റഷീദാണ്. ഇന്നത്തെ ക്ലാസിന്റെ വിഷയം അഹംഭാവവും ഹോമിയോപ്പതിയും എന്നുള്ളതാണ്. ഇന്നത്തെ ക്ലാസ് തുടങ്ങുന്നതിന് മുമ്പായി നമുക്ക് ഒരു നിമിഷം ഈശ്വര പ്രാർത്ഥന. നന്ദി. ഡോക്ടർ റെഡിയായി നമുക്ക് ക്ലാസ് എടുക്കുവാനായി എത്തിയിട്ടുണ്ട്. അഹംഭാവവും ഹോമിയോപ്പതിയും എന്നുള്ള വിഷയത്തിൽ ക്ലാസ് എടുക്കുന്നതിനായി ഇന്നത്തെ ഗസ്റ്റായ ഡോക്ടർ റിജീഷ് റഷീദിനെ വളരെ സ്നേഹപൂർവ്വം സ്വാഗതം ചെയ്യുന്നു. ഡോക്ടറെ ക്ലാസ് തുടങ്ങും.
ഗുഡ് ഈവനിങ് ഓൾ. എല്ലാവരും സുഖമായിട്ടിരിക്കണമെന്ന് വിശ്വസിക്കണം. ഓഡിബിൾ കേൾക്കുന്നുണ്ടോ?
ഒഡിബിൾ ആണല്ലോ. ഒഡിബിളാണ്. ഒഡിബിളാണ്.
ഓക്കെ. ഇത്രയും ദിവസം കണ്ടിന്യൂസ് ആയിട്ട് ക്ലാസ് എടുക്കാൻ പറ്റാന്ന്, അല്ലെങ്കിൽ ഇത്രയും വരെ കണ്ടെത്തി ക്ലാസ് എടുക്കാൻ പറ്റാന്നുള്ളത് ഒരു വലിയ കാര്യമാണ്. അപ്പോൾ എല്ലാ തവണത്തെയും പോലെ തന്നെ അത് ആദ്യമേ തന്നെ പറയുവാണ്. പിന്നെ നമ്മുടെ ടോപ്പിക് എന്ന് പറഞ്ഞാൽ അഹംഭാവവും ഹോമിയോപ്പതിയും എന്നുള്ളതാണ്. അപ്പൊ നമ്മള് ശരിക്കും അഹംഭാവം എന്ന് പറഞ്ഞ് കേൾക്കുമ്പോൾ തന്നെ അത് എന്താണെന്നുള്ളൊരു ഐഡിയ നമുക്ക് ഉണ്ട്. പക്ഷെ യഥാർത്ഥത്തിൽ അഹംഭാവം എന്നുള്ളൊരു ഡെഫിനിഷൻ അല്ലെങ്കിൽ ഇത് പോസിറ്റീവ്ലി എടുക്കുന്നത് എങ്ങനെയെന്ന് വെച്ചാല്, ശരിക്കും നമ്മുടെ സദ്ഗുരുവിന്റെ അടുത്ത് ഡിസൈപ്പിൾസ് ഒരു തവണ ചോദിച്ചിട്ടുണ്ട്, എന്താണ് ഈഗോ എന്ന് ചോദിച്ചിട്ടുണ്ട്. ഈ ഈഗോ വളരാൻ അനുവദിക്കാൻ പാടില്ലല്ലോ, അല്ലെങ്കിൽ ഈ ഈഗോനെ നശിപ്പിക്കേണ്ടത് എങ്ങനെയാ എന്ന് ചോദിച്ചിട്ടുണ്ട്. അപ്പൊ അതിന് അദ്ദേഹം പറഞ്ഞൊരു മറുപടി എന്ന് പറയുന്നത്, അഹംഭാവം എന്ന് പറയുന്നത് ശരിക്കും പറഞ്ഞാല് യഥാർത്ഥത്തിൽ നശിപ്പിക്കുവാൻ വേണ്ടിയിട്ട് ഉള്ളതല്ല. അത് നമ്മൾ നമ്മുടെ അമ്മയുടെ ഗർഭപാത്രത്തിലായിരിക്കുന്ന ആ ഒരു ടൈമിൽ തന്നെ, അതായത് നമ്മളില് ജീവന്റെ തുടിപ്പ് ആദ്യമായിട്ട് വരുന്ന ആ സമയം മുതൽ തന്നെ ഈ ഒരു ഭാവം നമ്മളില് ഓൾറെഡി ഇൻബിൽട്ട് ആയിട്ട് കിട്ടിയിട്ടുള്ളതാണ്. അതായത് അഹം, ഞാൻ എന്നുള്ള ഒരു ഭാവം, അതാണ് അവിടെ ഉദ്ദേശിക്കുന്നത്. അപ്പം ഒരു നമ്മൾക്ക് നമ്മളുടെ ആ ഒരു ലൈഫ് ജേർണിയിൽ അല്ലെങ്കിൽ ജനിക്കുന്ന സമയത്ത് തന്നെ നമുക്ക് കിട്ടിയിട്ടുള്ള ഒരു കാര്യമാണ് അത്. അല്ലാതെ നമ്മളുടെ ഏതെങ്കിലും പ്രവൃത്തി ഉണ്ടോ, നമ്മളുടെ എന്തെങ്കിലും നമ്മൾ അച്ചീവ് ചെയ്ത എന്തെങ്കിലും പൊസിഷൻ ഉണ്ടോ, അല്ലെങ്കിൽ നമ്മളെ സൗന്ദര്യം ഉണ്ടോ, അല്ലെങ്കിൽ നമ്മളെ സമ്പാദ്യമുണ്ടോ, അതൊന്നും നമ്മൾ നേടിയെടുത്ത ഒരു കാര്യമല്ല ഈ അഹംഭാവം എന്ന് പറയുന്നത്. ഞാൻ എന്ന ഭാവം എന്നുള്ളത്. അപ്പം ഞാൻ എന്ന ഈ ശരീരം എന്നുള്ളതാണ് അത് ഉദ്ദേശിക്കുന്നത്. അതായത് ഞാൻ ഈ ശരീരമാണ് എന്നുള്ള ആ ബോധ്യം, അല്ലെങ്കിൽ ഈ ശരീരത്തിൽ ഞാൻ ഭാഗ്യമുള്ള ആളാണ് എന്നുള്ള ആ ഒരു ബോധമാണ് യഥാർത്ഥത്തില് അല്ലെങ്കിൽ വാസ്തവത്തില് അഹംഭാവം എന്ന് പറയുന്നത് നമ്മുടെ ഒരു സ്വയം സുരക്ഷയ്ക്കുള്ള ഒരു ഉപാധിയായിട്ട് പ്രകൃതി നമുക്ക് നൽകിയിട്ടുള്ള ഒരു കാര്യമാണ്. പക്ഷെ ഇന്നിന്റെ ഒരു കാലഘട്ടത്തിൽ എന്താണ് സംഭവിക്കുന്നതെന്ന് വെച്ചാല്, ഓരോ മനുഷ്യനും അവരവരുടേതായിട്ടുള്ള ഒരു വ്യക്തിത്വമാണ്. അപ്പൊ ഈ വ്യക്തിത്വം വന്നിട്ട് ഒരു സ്റ്റേജിൽ അത് ഈഗോ ആയിട്ട് മാറുന്നുണ്ട്. അപ്പൊ അത് ഈ ഒരു ഈഗോ അല്ലെങ്കിൽ ഒരു ഞാൻ എന്തോ ആണ്, അല്ലെങ്കിൽ എന്നെ കൊണ്ട് ഇത്തരം ചില കാര്യങ്ങൾ പറ്റും, അല്ലെങ്കിൽ ഞാൻ എന്റെ ഐഡന്റിറ്റിയിൽ ഹാപ്പിയാണ് എന്ന് ചിന്തിക്കുന്നതിന് പ്രശ്നമൊന്നുമില്ല. ആ സെൽഫ് എസ്റ്റീം എപ്പോഴും നല്ലത് തന്നെയാണ്. ഓരോ മനുഷ്യനും സെൽഫ് എസ്റ്റീമോട് കൂടി തന്നെയാണ് ജീവിക്കേണ്ടത്. പക്ഷേ നമ്മളില് ഈ ഒരു വ്യക്തിത്വം, അതായത് ഈഗോ കൊണ്ട് ഉണ്ടാവുന്ന ഒരു വ്യക്തിത്വം, അത് അപകടകരമായി വളർന്നു കഴിഞ്ഞാൽ ഭയങ്കര ബുദ്ധിമുട്ടാണ്. അതായത് ഇത്തരക്കാർക്ക് തൻ്റെതായ ഒരു നേട്ടം അല്ലെങ്കിൽ ആ തൻ്റെതായ ഒരു ആവശ്യങ്ങൾക്കായിട്ട് അല്ലെങ്കിൽ അത് നേടിയെടുക്കുവാൻ വേണ്ടിയിട്ട് ഏതറ്റം വരെ പോവാനും മടിയില്ലാത്ത ഒരാൾക്കാരായി മാറാറുണ്ട്. അത് നമുക്കും ബുദ്ധിമുട്ടാണ്, നമുക്ക് ചുറ്റുമുള്ളവർക്കും ബുദ്ധിമുട്ടാണ്, അതുപോലെ തന്നെ സമൂഹത്തിനും വളരെയധികം ബുദ്ധിമുട്ടാണ്. നമ്മള് ശരിക്കും മനസ്സിലാക്കേണ്ട ഒരു കാര്യം എന്ന് പറഞ്ഞാല്, ഈ പറഞ്ഞ മാതിരി എല്ലാ വ്യക്തികളിലും എവ്രിബഡി ഹാസ് പോസിറ്റീവ് ആൻഡ് നെഗറ്റീവ് തോട്ട്സ്. എല്ലാവരിലും നന്മയും തിന്മയും ഉണ്ട്. നമ്മുടെ എല്ലാ മതഗ്രന്ഥങ്ങളും പഠിപ്പിക്കുന്നതും അത് തന്നെയാണ്. കാര്യം നന്മയും തിന്മയും ഇവിടെ തന്നെ ഉണ്ട്. അതിൽ ഏതാണ് വേണ്ടത് എന്നുള്ളത് നമ്മൾ സെലക്ട് ചെയ്യുക എന്നുള്ളതാണ്. ഇപ്പൊ ശരിയും തെറ്റുമാണെങ്കിൽ പോലും അങ്ങനെ തന്നെയാണ്. ഒരാളിന്റെ ശരി മറ്റൊരാളിന്റെ ശരി ആവണം എന്ന് നിർബന്ധമില്ല. അപ്പൊ നമ്മൾ ക്ലിനിക്കൽ ആസ്പെക്റ്റിൽ ചിന്തിക്കുമ്പോൾ അഹംഭാവം നമ്മൾ എങ്ങനെ എടുക്കും എന്നുള്ളതാണ്. പലപ്പോഴും നമ്മൾ കേസ് ടേക്കിങ്ങിന്റെ സമയത്ത് ഇങ്ങനെ പറയാറുണ്ട്. മീൻസ് ഭയങ്കര ദേഷ്യമാണ്, അല്ലെങ്കിൽ ഒരാളെ മൈൻഡ് ചെയ്യില്ല, അല്ലെങ്കിൽ ആ പറയുന്ന കാര്യത്തിൽ തന്നെ ഉറച്ചു നിൽക്കാറാണ് പതിവ്. അല്ലെങ്കിൽ ഇത്രയും കാലം ഞാൻ കൂടെ ജീവിച്ചതാണ്, ഇത്രയും വർഷം ഞാൻ കൂടെ ജീവിച്ചിട്ട് ഡോക്ടറെ എന്നൊന്നും മനസ്സിലാക്കാൻ ശ്രമിക്കുന്നില്ല, അല്ലെങ്കിൽ ഞാൻ എന്തോ കുറഞ്ഞ ആളായിട്ട് കരുതുന്നു, എനിക്കൊരു ഇത്തിരി വില തന്നിരുന്നെങ്കിൽ എന്നൊക്കെ പറഞ്ഞ് വരുന്ന ഭാര്യമാരുണ്ട്. ഭർത്താക്കന്മാരാണെങ്കിലും വരാറുണ്ട്. എന്തൊക്കെയോ ഞാൻ ചെയ്തു കൊടുത്തിട്ടുണ്ട്. അവരുടെ മുൻകാല സാഹചര്യം വെച്ച് നോക്കുമ്പോൾ ഞാൻ അധ്വാനിച്ചിട്ട് പല കാര്യങ്ങളും ഞാൻ നേടിയെടുത്തിട്ടുണ്ട്. പക്ഷെ ഒരിക്കൽ പോലും എന്റെ നേട്ടം അല്ലെങ്കിൽ എന്റെ അംഗീകാരം അല്ലെങ്കിൽ നിങ്ങൾ നല്ലതാണ്, നിങ്ങൾ എനിക്കൊരു അഭിമാനമാണ് എന്ന് പോലും പറയാത്ത അല്ലെങ്കിൽ പറയാൻ ആഗ്രഹിക്കാത്ത ഭാര്യമാര് എല്ലാം, അതായത് എന്റെ കൺട്രോളിൽ അല്ലെങ്കിൽ ഒരു കമാൻഡിങ് പവറിൽ ഞാനാണ് എല്ലാം എന്നുള്ള രീതിയിൽ വരുത്തി തീർക്കാൻ ആഗ്രഹിക്കുന്ന ആൾക്കാരുണ്ട്. നമ്മൾ പറഞ്ഞു കേൾക്കുന്നതിനേക്കാൾ ഭീകരാണ് ഇങ്ങനെയുള്ള ആൾക്കാരുടെ കൂടെ ജീവിക്കേണ്ടി വരിക എന്ന് പറയുന്നത്, അല്ലെങ്കിൽ ഇങ്ങനെയുള്ള ആൾക്കാരുടെ കൂടെ നമ്മൾ വർക്ക് ചെയ്യേണ്ടി വരിക എന്ന് പറയുന്നത്. അത് നമ്മൾക്ക് ഒരിക്കലും, അതായത് ഹോമിയോപ്പതി മെഡിസിൻസ് നമ്മൾ നമ്മളുടെ എന്താണ് പറയുക, നമ്മൾ മയാസ്മാറ്റിക് റെമഡീസ് അല്ലെങ്കിൽ നമ്മൾ കോൺസ്റ്റിറ്റ്യൂഷൻ അല്ലെങ്കിൽ നമ്മൾ മൈൻഡ് ലെവലിൽ അപ്ലൈ ചെയ്യുന്നു, ഏത് തരത്തിൽ തന്നെ നമ്മൾ അപ്ലൈ ചെയ്താലും അല്ല ബാക്ക് ഫ്ലവർ റെമഡീസ് നമ്മൾ അപ്ലൈ ചെയ്താലും ഇതിന്റെ ഒരു തീവ്രത അല്ലെങ്കിൽ കാഠിന്യം നമുക്ക് കുറയ്ക്കുവാൻ മാത്രമേ സാധിക്കുകയുള്ളൂ. അല്ലാതെ നമുക്ക് ഇത് മൊത്തത്തിൽ നമുക്ക് എടുത്തു